Thank you.
There you go. Okay, this is the bulk of the meeting. Share screen again. I'm going to the Civic site, this Civic Drive thing, share screen. All right, now. Okay, so basically civic documentation, as you, this civic documentation thing up here is what Krishna used to maintain on the WLS, and that we migrated a lot of the stuff over here, and then I created categories and stuff for easy look. But some things span different categories, so that's this miscellaneous topics that can't be kind of comfortably put into the other ones. So admin will be everything, the forms we have to fill out. For example, Loretta made a new, well, there's an insulin form even in there, maybe, I'm not sure. There's things on that, there's lists, there's the list of volunteers' names. I don't know what's going on here. Let me go back. SBO Drive, I don't know what that is. I think it double-clicked twice. Why? Boy, is it slow. I'm clicking and it's not doing anything. All right, so admin lists, Medicare minutes, everything that everybody asked for Medicare minutes. This is the miscellaneous topic. I'm not going to bother with that, but scrolling down is part A, everything to do with specifically part A, everything to do with specifically part B. C is everything to do with maps, and part D. And I'm going to go into two things today to show you for this meeting. One is up here that has to do with insulin. I hope it's there. I'm clicking that. See, it's going, I double click and it's not open. Insulin. It's not doing, it's supposed to say insulin, so I don't know how it got there. Something's not working. Insulin. Oh, maybe it's under drugs. Might be drugs. There we go. Okay, so it's under part D, drugs, obviously stupid. I didn't follow my own rules. So do you see these three things? Insulin coverage here, insulin worksheet, and IRMA and insulin in the plan finder. So from that meeting, one of the SHPTA meetings we had the other day, we had this insulin and the plan finder. These are the steps that SHPTA wants us to do when we deal with the plan finder. I printed out these. I sent it in an email the other day, and I now put it in a document so you don't have to fish for it in an email. And essentially, I don't think I have to go over this with you. Many of you have seen the program. I don't want to belabor anything, but to deal with the plan finder, you have to, if you know somebody's on insulin, you have to put it in without the insulin, calculate it, and on step 9, add back 420, which is 35 times 12. Then go back in and update the list to include insulin and see which plans even have it, because if they have it, some of the plans might not have it, the ones that you chose based on no insulin. It's much more complicated. Marna thinks it's going to be very, crazy complicated.
I think so too.
And it's because they couldn't get it in time for the new plan finder settings. They couldn't get everybody to revise, all the plans to revise what they did. I'm having trouble going back. My back button is not working. I don't get it.
So Julie, when you're clicking to opening new documents, it's opening it in a new tab. So up at the top of the screen, you see how there's multiple tabs going right now?
No, don't have to lower it because it was, I have those controls in the way. That's the reason why.
Oh, okay.
Okay, so I don't know how to do that. Here, I got it. Okay, so back to part D. Here we go. Thank you very much. Yeah, all those share controls were there. Okay, now the next one is, this is what Medicare.gov, just basic description of insulin, which you probably all know already. And the one that's important that I think that Diane, somebody sent this, either Diane or Loretta. This is a worksheet you can do at the civics that you can write that stuff in to do a calculation and keep the documentation going on the research you've done. So I've put all of those in the under, so it's in part D, it's in documentation, the drive. This is what I call the drive. And then part D, which is everything to do with drugs. And I put the three, insulin, insulin, insulin together in there, grouped, because that's the new stuff on insulin. All right, now I'm going back
How do
to,
we get to the drive?
the drive is a link that I've sent everybody. I can send it again to everybody, but from very early on, I've sent this link on once I started migrating Krishna's material about 3 months ago, and I created this thing, so we put things here. As you notice, the recordings are here for our meetings. So you can go in here, but we can only store on Loretta on the computer, a couple of them at a time. We may provide you with a YouTube. We created a YouTube link so you can see it on YouTube without using up our storage, but we keep the most recent recordings there just in case you can't get to the YouTube. There's high cap resource. Go ahead.
So I have to look at my email from 3 months ago to find that?
No, I'm going to send it to you again. I can send it to you again. But I've shared it with anybody. It's shared. This folder can be opened by anybody who has the link. So when I send you the link, it means that you can then put it as a bookmark on your computer. That's the way this works. And it's very frequently updated. I mean, every time Diane sends me a Medicare minutes, it's going in here. And not only is it the Medicare minute, but it's the handout, the script, and I do it consistently the same way. I'm trying to open it now. I'm double clicking. It's not doing here. So it's number 111. So the first one is the handout. The next one is materials. The next one is script. And then the next number 2 would be enroll, handout, material, script. I'm trying to do it everything exactly the same all the time so that you can find it easily by intuition, and also up here, search drive. So if I want to put insulin up here, you don't even have to use intuition because it's going to list you everywhere in the drive that I've talked about it or it's talked about. So there's multiple ways to use this, and you have a constant resource on the computer that is fantastically updated because I spend a lot of time on this. And if you need me to put in something like Diane has sent things, or Loretta finds something, or Marna's thing is in here now. Remember, she just sent us, or she sent it to me, but somebody asked for her new, what's it called? The thing she makes.
Quick reference.
The quick reference, right? So I've actually put it under her name, Marna's Civic, because she called it a quick reference this time because somebody asked her and she wasn't ready to produce a real one yet. So she gave us this in between one. And I put that up as Marna's quick reference. And it will be replaced when she does the whole thing under her name, Marna. So everybody knows it's Marna's thing. This is what she did for us for today. Because somebody wanted it. I think it was McNamara who did, right? I think so.
Yeah, it was me. I asked her because of the hot library tomorrow.
Right, and she responded for you very quickly.
She said, thanks for the nudge.
Yeah, right, there it is, and she did it. So now looking at again at the we covered the insulin, we covered the training, we covered Marna's. Now the big topic. If anybody wants to have a topic right now is your chance, because the next subject is going to take at least 20 minutes. It's amazing. Anybody want to say anything first, add anything? All right. So this has to do with the New York City plan that everybody knows is defunct now. It stopped in the courts, that New York Alliance, big talk, big, a lot of yelling and screaming going on last year because everybody wanted to keep, the municipal unions wanted to keep, a lot of people wanted to keep what they thought was senior care, which paid all their bills. And to tell you the truth, I always thought that it was acting like a Medigap. I've considered it like a Medigap because they said all my bills are paid for, and they have, they kept saying, I have original Medicare, and this thing pays the rest. I personally am in the other choice, the HMO choice. but all these people have been in senior care. They said, we don't have to get prior authorization. It just acts like Medicare. So I said, fine. So in the documentation now, I want to open to this page called temporary folder for JW for this meeting, because there are documents here that I want to show you what happened to this city plan. And it all came 3 days ago when a girlfriend of mine from the city, a guidance counselor, retired, has end-stage renal disease husband, 3 years now, dialysis a lot of bills. And she got everything paid for the past couple of years. She called me up. She said, what is going on? I have these bills all over the place. I don't know what's going on here with these bills. She's on senior care purposely, so she doesn't have a worry with him with his end-stage renal. And I said, well, the first thing is I can think of is coding, because I thought I was being naive and thinking this whole thing is just going to be paid for no matter what, like everybody's been yelling and screaming and protesting and marching and everything. Keep our senior care. We don't want Advantage Plan. And so I said, the other thing I can think of is go down to the UFT Welfare Fund office, which is the one that manages all the healthcare plans down there for the union. And for everybody not in the union, the UFT is the largest member of the city union. So what they do affects all of them because it's such a bulk of the city unions. So she went down, and from the lady's office, this is what happened. She told the lady, please call me, let Julie come in on this conversation so that she can ask the right questions. And as the lady started talking, hi, how are you? She said, she all of a sudden dropped out of her mouth, well, senior care is a PPO, which nearly made me fall off my chair, because PPO, of course, is an Advantage Plan, and all these people have been thinking that they are not in an Advantage Plan when they're in senior care. And they've been yelling and marching and taking the city to court. Keep Advantage Plan out of our healthcare system. We don't want it, but they've been in it. So I said to the lady, are you kidding me? This is a PPO? So what she did, she said, she said, I'm giving Terry the 3-page letter, which looks like this, describing the thing, which was sent apparently to people on January 1st. Terry never got it. My loud activist friends never got it. And Flo, to check all this out yesterday, I called Flo, who's in senior care too, to confirm everything with her of what was going on. She couldn't believe it either. She didn't get it, and she would have read it, nor my activist friend who's a blogger running these very activist and running some of these marches. He swears he throws everything out. He's not, he knows it. He acknowledges that he throws, but Flo doesn't throw everything out. And Terry, who's my friend with all those bills, she doesn't throw anything out. She never got this letter. Now look carefully at the letter. You have to meet the 233 Medicare deductible in senior care, and you have to meet a GHI, the senior care is GHI deductible. So for a couple, that is $566 per year right away that they didn't know about. Look at this sentence. Below is a list of commonly used services that will have a copay. That's why she got all those bills.
It's a crime.
That had never been picked up, that had always been picked up before. So they shoved all these people into this senior care. They call it GHI CBP, complete benefits package or program. What is that, Michelle? Is it complete benefits what?
She left the.
Oh, she left the meeting for a minute. Okay, so now, while this is not a full list of services with a copay, we've included the most common ones. Now, with regard to hospitalization, yes, Blue Cross Blue Shield covers the hospitalization part, for which they pay a very tiny rider, like a couple of bucks. But they don't tell you all the inpatient stuff. They don't get an EOB. They don't even get what the costs are going to be for those copays for all of those things. They did get, are all aware that they were being charged 15 and 15 for the primary and the specialist, but not for these labs. Now, the next page clearly says at the top, GHI, Emblem Blue Cross Blue Shield Senior Care. This is their plan. GHI CBP, Comprehensive Benefits Package or Program, something like that. And this is, the GHI part is up top. Primary and specialist are 15. And they use the terminology of 20% to kind of make it seem as if they're acting like original Medicare, but absolutely not with all those copays. It's like fake. Now here for the hospital on this thing, look at how this is working. It's exactly like an Advantage plan. There is no $1,500 covered by a Medigap for a deductible. There's $300 per person per admission with a cap at $750 a year. So this is exactly like the way the Medicare, the Advantage plans work with that daily thing, not the $1,500 walk-in deductible, but the 3 days, 5 days at a certain amount. This is the way those work. And then this is their plan. I'm not going to bother with the drug component, but it's a separate rider for the drugs. The drug is included. But here's the tell-off. Third page of what the UFT lady gave me. PPO, clear as day. So it's not even that the lady in the office used the word PPO that caught my ear, and my activist friend said, oh, they don't know what they're talking about. They say whatever Mulgrew wants them to say. But written documentation says PPO. They have been boondoggled.
Yes.
So that's one document. And then I'm going to go back and show you, here is the card for in-service. So I said, did you get a new card? No, I don't want in-service. I want, this is the card, their card. Right now, I asked my neighbor next door, it was also in a senior care plan. I blotted out the name and the number here, but this is the way their card looks. Tell me if that looks like a Medigap card or a Medicare Advantage card. Any one of us would look at that and say, that is a Medigap card. There's no primary on it. There's no specialist. There's no copays. There's no drug inclusion. There's nothing. It looks like a Medigap, and the back end of it says where to send the information, but that front says Medicare is primary, bill Medicare first. It looks so that this is the card they've always had. They didn't get new cards. The lady told them they're going to be getting new cards. Well, why did they delay getting new cards? Because they've turned it into a bloody PPO. And the PPO cards, when I give the Demystifying Medicare lecture, card samples, I put these up on the screen to show them that the Medicare card looks like this on the left. The Medigap card, very simple card, just mentions Plan F, Plan N, Plan G, your name and when you're enrolled. The drug card, which you give to the doctor, very simple card. But then if you have a health plan, if you have an Advantage plan, you're getting one of these, which specifically says HMO. Specifically at the bottom left, it says the PP. It's a very complicated card with the RX on it. So what the card that they are now holding is senior care looks like it's functioning like a Medigap, but it is, the new cards are coming and it is turned into a PPO without them knowing it. So the other things in here which you should know about is that the rates changed. This is the wall chart they offered as of this last summer, which is all the city plans. And GHI is this first one down here, the senior care. You can enlarge it on yours. Let me see if I can enlarge it here. Yeah, this is senior care. It says so at the top if you have the screen big enough, which is everything that other document said. This is this is my HMO, the one that the rest of us take, which is through HIP. And if even the HIP ones, look at this as of October, it went everywhere in New York State. You can go to any doctor in New York State. Even that's more expansive than just tiny Westchester doctors. So that is the current one. I'm not sure everybody will know about that chart because they change mid-year. And then you have the New York, this is what's on the city. No. Yeah, this is, I made a document. What's on the city website is this screen at the top. When I move my cursor, do you see me move my cursor or without no cursor, right?
Yeah, we can see the cursor.
You can see the cursor move like that
Yeah.
instead of me saying, look at the
Yeah.
top. Okay, so the changes to the GHI, this is the big screen at the top of the New York City retiree plans page. So it said retirees were mailed a letter December 2021. That's a lie regarding changes to the Blue Cross Blue Care senior plan. And so it's saying, yeah, they made the changes, but nobody got those letters. I clicked the learn more, and the learn more expands to this page, which is exactly what the lady handed out from the UFT office. Then if you click this other link from that site, it describes senior care. At that link, this is the description on the web. The web page looks like this. This is what senior care. If you are a retiree with Medicare Part A, you can enroll in our senior care. This supplements your Medicare. They're selling it like a supplement, like a Medigap. They're not mentioning the word Advantage Plan. You will have a deductible, we know about that, to pay before your plan starts to pay. They're keeping that aura, that feeling going as if they're just supplementing the cost that Medicare doesn't pick up. Then it goes into the plan details, which are exactly the same as what that letter said. And then if you click the download a PDF, you get this brochure, which is exactly the same thing. All of this was done. This booklet now, I've put the booklet in our drive as well. It is called maybe this. Let me try this. If not, I have it somewhere else. Yeah, this is the booklet. This was produced. This is for in-service is the first half of the book, and retiree is the second half of the book. So it's like in the 60s, page 60 or something, retiree coverage for retirees. So if you go here, this is all the plans. In here, this is the extent of which they don't go into a big booklet that I get from my Medicare Advantage plan, which is about a half an inch thick. They just don't do it. Here's your GHI senior care. It's very minimal. That's for DC 37. There's another one for the regular GHI. Here's senior care for the teachers and everybody else. That same one pager. Nothing big, nothing like what an Advantage plan gives you. So these resources, I don't know, what's your opinion? Should I leave them, since I'm talking about New York City, should I leave them in something called temporary for JAW, or should I put some of these back into the drive into like make a New York City column here for anybody who gets inquiries about New York City? Which would you prefer me doing?
Julie, this is Linda.
Yeah.
I appreciate all you've done on this, and I am in awe of what you know. I have no intention of counseling anybody with a New York State teacher plan, whether it's in the city or out here in Westchester, because we don't tend to do retiree plans that are separate from Medicare.
I thoroughly agree with your idea, your comment. I agree with you. I don't think I can't counsel either. But since especially around this time of year, we get these people asking the question, and I don't want to turn them off right away. I
would call you, Julie, and say, will you speak to this person?
Yeah, I can do that.
I will not.
I can do that. We can take a few people who are very familiar with it. Flo might be able to answer questions on the phone with it.
Sure.
I agree with that. Just like I would refer to you to, and I have IBM stuff, right? Which I would like you to mention, because I know you just got a letter for new IBM stuff. One of you, Bob or you, is going to talk. Bob, I think he's going to. I asked him to say what he has to say, if you can contribute to that. I've asked you in the past, right? But I was talking to Bob. So yes, each of us has a specialist area. And of course, so don't turn them away. I can really help them. But we have to have the background knowledge of what's going on in the city so that you can understand their pain in a way. That's what I want. You know, you have to, the compassion of our service can give them some feel that we can perhaps help them a little bit or guide them the next direction without, you know, don't shut them down, because there's a
Julie-
large percent of people who have the problem.
Julie, I would create a New York City section. I'm not going to remember that you guys.
Put it there. Okay, I'll just move them over later. All right, that's that. Now, could somebody, Michelle, please tell them what you said before? Did she go? No.
I'm not, yeah, I'm not sure it's all that meaningful. I'd like to say first, it has been since, I think I'm going into my 14th year now of counseling. And since the inception, we have always said we would never, ever try and involve ourselves in retirement plans because there's way too much. I mean, when I get somebody with a retirement plan, what I tell them is, here are the questions you should go to your HR department and clarify it. But to sit down and try and read and understand a retirement plan, I think is something way out of our scope. And I would worry about the liability of doing that for myself or for any of us. So I just don't know how far I would go with this, agreeing with Linda. But anyway, so what we were talking about is up, as most of you know, I'm in Saratoga, and almost everybody I have come across in the Capital District is on a Medicare Advantage plan. A huge amount of them are CDPHP. When these people, and I talk to them, I'm a member of the Saratoga Senior Center. I have also, through my other affiliation with New York State Senior Action Council, and I am a SMP volunteer. So I speak at the various senior centers up here about fraud. And when I go and I start talking to people and they start talking about various things, they always, when I ask them what kind of plan they're on, they gleefully say, I'm on CDPHP. They gleefully talk about Medicare Advantage plans. The senior centers up here who do not take public funding, outside funding, who are private, can promote any Advantage plans, and they do promote Advantage plans all the time. I've been in rooms as an SMP where the whole room is just filled with Advantage plan people. They totally can get away with it. And any rule that I've ever been instructed to inform people about in terms of how a broker can approach a private person is thrown out the window because they're all in a room. You chose to go into the room and they can just aggressively market to you. So that's all I was saying earlier. There's nothing that can be done about it. It's legal because they are privately funded. And
Okay.
It's very incredibly concerning and upsetting.
Okay, so as to the liability, first of all, I would never counsel to carry through. This is what I would never explore the options under the 10 city plans with them. Absolutely never do that, because first of all, it's too complicated and I don't want to get into that. That's not our function. But I want to be able to direct them, and I want them to be able to the volumes that are out there, the paperwork that's out there, because they're not being helped by the city that much. As you can see, they didn't get that letter. I know more. And so I want to be able to say, here's the letter that was supposedly gone out. Many people didn't get it. And here's the booklet that I know about because I research it. It's on there, the Municipal Labor Union site. You can get it. It's there for everybody who works for the city, who's a retiree or not a retiree. That's hundreds of thousands of people. It's there, but they don't know how to get this information. So I will definitely continue to help them with that. And I would definitely also add to it that for, as far as the city is concerned, retirees, there are 10 plans out there. I would tell them that most people fit into the first two categories, but it's completely your choice. And I would also say that the open enrollment period for the city plans is just 1 month, November 1st to November 30th. And that you should always call the welfare fund associated with your union who's providing it. DC 37 or the supervisors union is different from the UFT. So those are the bits of information I would do. And I think we should be doing it. And I think any of you could do that too. Those are basic things that would put these people in the right direction. And after they explore it on their own, of course they could call me. But I don't see anything's wrong with that, Michelle. And I don't think it's liability. There's nothing liability in that. Did she go? Did she leave? Oh, you're mute. You're mute. Yeah.
I'm here. I understand what you're saying. I'm saying as a counselor would not want to take that on. I would be happy to pass them on, but I would not take that on. I just wouldn't do it.
You wouldn't do it. Okay, so we're living maybe closer to New York City. Some of us, even in this group, are in New York City, have these plans, right? So maybe we're a little bit more comfortable just giving that, not telling them which one to go. I would never do that. I wouldn't use the plan finder with them. I wouldn't, but I would direct them to where that plan finder is because it's not easy to find. You really have to know how to search it out, that wall chart, that blue thing that I showed you. Can't find it.
That's good. Okay,
Yeah,
that's great. Very good.
Okay, so I know you're a senior patrol and you're very careful about these issues, which is why I respect so much your judgment, but I don't think I'm transgressing by providing that kind of information for them. I'm not doing a plan finder with them. I refuse.
Yeah, SMP is about fraud. It's not about this at all, but that's a separate issue. But I'm just saying, as a counselor, and what our liabilities are, and what we're here to do, and it's not to help people analyze a retirement situation. That's the first thing I say to somebody when they come start talking about a retirement plan, and should they take it versus, you know, an individual plan. And that's the first thing I say. We never have been told to counsel people on what to do with their retirement plan. I have no recollection of anybody ever telling us that would be something that we should do. That was my only point.
Well, I do get a lot of questions over time people raise their hand all the time for demystifying when they say, yeah, but I have other considerations. I have a dependent, I'm still working, all of those. It's in that area of what are your available stuff. And if they mention that they happen to be in the municipal thing, I want to be able to provide those resources to them because they're just hard to find, as I mentioned. But I think it's in that category of when I get a lot of questions about people who are either still working or going to retire, but going to have the city plans or going to have IBM plans. That's the nature of the game living down here. We're getting those questions a lot. So I have to know how to do it, and I'm staying within bounds. I won't go through their plans with them, and IBM either. So Bob, could you tell us what you just got from them, because this is new?
Well, all of the IBM retirees, as you know, in 2013, IBM dropped their retiree medical plan. As of, you know, so currently right now, IBM retirees through VIA benefits can purchase a plan, a PDP, a Medicare Gap, a Medicare Advantage. And if they do that, they will receive a subsidy. Usually, I think it's $3,000 a year. They will be reimbursed for up to $3,000 worth of medical bills if they purchase a plan through VIA benefits. Starting in 2023, and we received just a pamphlet and a brief letter on this, IBM is now offering a Medicare Advantage plan. The plan has two options, one called Enhanced and one called Essentials. And in order to continue receiving your subsidy, you have to purchase the Medicare Advantage plan with one of those options. So they're no longer dealing with VIA benefits. You only get the subsidy if you go with the Medicare Advantage plan.
Bob,
Yeah,
it's Linda. I think we've lost our subsidy. You're going to
No.
get that one time subsidy, but you're not going to get the subsidy that you used to get.
well, I didn't say that. I just said they will continue providing a subsidy if you purchase the plan. Now, how they provide that subsidy gets more complicated, whether you take the enhanced plan or the essential plan. But the thing is, the big picture is that if you get an IBMer, they will be faced with this plan that is a Medicare Advantage plan. And there is a question about how much, if any, of their subsidy will be provided. Now, IBM in the pamphlet that they sent out said that they would provide written information and details on this by the end of September. As far as I know, no one has received that mailing yet. And here it is, the 10th of October. There is a website that if you go up on the website, you can find PDFs that describe the plan. And on one of the pages describing the plan, there is a link to how the subsidy will be provided. And it's a PDF with a one-page chart, and it shows how they are going to provide the subsidy depending on whether you use the enhanced plan or the essential plan. So there is a credit that's provided. So the subsidy gets rather complicated, Linda, and they don't provide any cost information on the premium in the plan details. They tell you to call a retiree center to actually understand what your premium will be.
I've
So
done that.
Yeah, and so what did they tell you your premium would be? I couldn't hear, Linda.
Oh, I'm sorry, zero.
Oh,
Yeah.
wow.
Yeah, the chart that retirees will see says that they can get a credit for a portion of their subsidy. If they take the enhanced plan, the premium is zero. The total out-of-pocket cost, I believe, is $750 for the year, whether you're in network or out of network. So without going into the details of the plan, because as the discussion we just said, this is a private retiree plan. It all comes down to understanding the new plan is a partnership between IBM and United Healthcare. It depends on which of your providers will accept that plan. So, the information has not been sent out yet in written form, but if people go up to the website, look at the details, and then call into the retiree center, they'll get the details. So in keeping with this idea of not really delving too far into specialized retiree plans, any IBMers who are confused about what the details might be, you could ask them, well, have they called the retiree center yet? Do they feel comfortable going up and going to the website that's outlined in the pamphlet we've been sent? You could ask them, have they received any mailing from IBM with the details? But the end point of it should be, they've got to call their retiree center if they don't really understand the details of the plan.
Makes sense.
Thank you, Bob. Thank you, Bob. Julie, would you please put your phone number on the chat? Because I've got some teachers in as my clients, and I know I'm going to start getting questions.
Yeah, we do get them. There's no doubt about it.
Krista, did you get my request for bookmarks?
Yes, and the bookmarks are in, so I'll get some out to you.
Okay, thank you. I don't know how United and Aetna got so involved in Advantage plans, but they seem to have taken over Medicare's enrollment in Medicare. And they did the same with my union in Putt Valley. It's now Aetna Medicare, Aetna Advantage, as opposed to Aetna Medicare.
Wow. They warned you, though. You got the advance notice, right? When they
No.
warned you?
No,
Oh,
this was about 5 years ago. We didn't
they
get
did.
any information.
Okay, Vaughn, while I'm in the chat adding my phone number, Vaughn, you added some stuff. What's that first link for? What are those links there? Or Krishna added the first links, right? Then
Oh yeah,
Vaughn-
I threw them in. The first link was just the ship TA portal link that you could find through Google. And then the second one was your demystifying Medicare.
Oh, that, yeah, okay, fine.
Yeah, Krishna was so kind as to, as I was explaining them, provide the links.
I wasn't watching the
I don't
links.
have a link to the third thing though, the training that you guys are on.
Yeah, I don't think it's up yet, but I'm gonna find it, the one that we had on 10/3 last Monday.
So this Capital District PHP, yeah, let me just make it clear. The senior care is called GHI. That's the company that runs it. Space. CBP, Comprehensive Benefit Package or Program. So, but it starts with the word in the city. It's the senior care, starts with GHI. That's what the card looks like. That's what the name of the plan looks like without me going back to share screen. So, Michelle, you said something about up there in the north, a lot of people are in something. What is the exact initials of the things up there? Mute, 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 mute.
P.
Unmute. Let me see if I can do it.
I'm sorry. I have
Okay.
men work in my house. That's why I keep turning myself
Oh,
off.
sorry. Okay.
CDPHP, and I'll tell you, Linda has a friend who has friends in the Albany area that have it, if I'm not mistaken. So it's everybody has it. I almost don't even have to ask. It's that common. It's shocking to me that it's that common.
Mhm.
Absolutely.
All right. Yeah, I haven't seen that one before, but it may be a question of regional. I've
Well,
seen.
I'm sure it's regional. It's all about the big hospital here is Albany Med, and then all the hospitals like Saratoga and so forth are all linked to Albany Med. So it is definitely, without a doubt, regional. But you've got a heck of a lot of state employees in the Albany area.
Okay, so I have a question to ask you, if anybody who has the answer to this. You know how when we get the Medicare book and the plan finders are in the back? I can't find where, when on the left-hand column, it says what region it's applying to, like New York City or all the boroughs in the city, or it says New York State sometimes. And sometimes it says Westchester, Rockland, and all of that. It uses the word Hudson Valley a lot. So Hudson Valley, does anybody know which all from Westchester all the way up to Albany? I don't, there's no description of their terminology in there. Anybody have any idea?
Don't know.
It's pretty wide ranging, Julie.
Yeah.
I've never looked, but Julie, I've never looked at that, but my guess is Westchester County in terms of premiums are pretty much the same as New York City. I think once you cross over that line, which I was 10 minutes away from going into Mayapack, it becomes Putnam. And that's where I think you hit what they're referring to as Hudson Valley.
Okay, that's interesting.
Hudson Valley.
And did I mention it in the last meeting? Because I certainly found it out. I may not have mentioned it, but I compared, stop me if I've said this before, but I compared the 2022 Medicare Advantage plans in the plan finder with the ones in the book. I went one by one to see if they were exactly what the differences were, if there were any differences, mistakes, blah, blah, blah. And I did discover that the plan finder is missing a column because two plans showed up online that were not in the book. And both of them were plans that had a health deductible. The column health deductible is not in the book for the Advantage plans. It's a missing column. These two plans had $1,000 health deductible, and they were not listed in the book, but they will come up on the plan finder. So I find that awkward. I also find it awkward that they don't give enough Part A information on the plan finder. Does anybody have that experience? In the book.
On the plan finder?
In the book. Like Medicare Advantage plans sometimes pay per day, like $250 a day or something, but the book doesn't have a column for anything to do with Part A.
Right, you have to go into the detail.
Yeah, for the online, right?
Yes.
Yeah.
I don't think I've ever used the book for a Medicare Advantage, to look at a Medicare Advantage, information for a client. I don't think I've ever used the book.
No, you don't, but some people.
I have.
You have, right?
Yeah.
I have, it was very accurate. It was exactly right, but it didn't have those two plans in it because they had health deductibles, which
Right.
the plan finder, actually where it says in the plan finder square, there's a square box which outlines the details of the plan. Right above the drug deductible, it has a line which says health deductible, and it's always zero for all the plans that are in the book. It says zero, but for those two plans, it said $1,000. I have used the book because some people are not computer savvy. They don't want to, they're on their own. I said, you can get a brief overview what's in there and then go for help at the civics to get the better. But if you're in Medicare, you're going to get a regional book that is for your area. It's useful. Go down and highlight the ones that are specifically Westchester if you want. It's basically the training for the people who want to do something on their own but are not computer savvy. But as counselors, we should never use it, Not so. But were there any other topics? All right.
I have a question,
Yeah.
a problem. I have at least two clients who are talking about going, retiring to a foreign country. How does that affect their Medicare?
They can't, if they test it out for a period, they're advised to keep up the Medicare Part B premiums, because if it goes over 12 months, of course, of the testing period, they'll get the penalty. I mean, if they drop Medicare, they'll lose the part. If they drop Part B premiums for 12 months, of course, they'll start getting a penalty for total every 12 months. But so what I tell people is that if you're in the test mode, right, keep your Medicare for 1 or 2 years. But if you absolutely sold out completely in order to babysit for your children in France, your grandchildren, and you know that that's where you're going to end up, then you can drop your Medicare because you're not coming back. But you really have to sell out in order to make that decision.
In other words, they can't get Medicare.
Can't
in
use
a-
it.
They can't get it.
They can't use it at all.
No.
Well, I know some people who have it, who live permanently abroad, but they come back, they keep it because they come back to use it, but they can't
Oh,
use it
okay.
abroad.
Okay, you can come back and use your Medicare.
If you have a residence, because
If you-
it's tied to
Yeah,
to a
if you
residence.
still have a residence, right?
And as
Okay.
long as you continue to pay that premium,
Yeah.
because once you stop paying that premium, there's nothing. There's a gap in your coverage all of a sudden. And
Right.
you can't continue that in another country.
Okay, thank you.
Yeah.
I just want to give them, I mean, I've been on playing phone tag with Medicare and I was going to ask them, but since you guys are experts, I thought I'd ask you.
Talking about calling Medicare, I also may have mentioned this before, but I used to get very frustrated because I would do a lot of research and then call them last resort. And then the lady would always say, she'd say, just a minute, let me look at my book. And I got so frustrated with them all the time. I said, no, don't go look at the book. I looked at the book already. I want more information than the book. Please listen carefully to my question. I got that. And so I was getting pretty short with them. It was annoying. And then I found out from somebody said that if you just say, I need to speak to the supervisor, you'll get one level up they have to put you through to the supervisor, even if you have to wait, which was interesting. But then one time I tried it and I've reformed myself because the man gratuitously, he told me, he said, no, 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 you don't understand. We have to look at the book. They make us look at the book because it's not as if for newbies. I thought they were training newbies, but she said, no, we're required to look at the book because they make changes frequently. And they want us to always give the right information. So we have to read you what the book says, even if we're experienced counselors.
Thank you.
So I'm not as hard on them as I used to be because they have their rules that they have to check for the most recent law. Is there anything else? Okay, next meeting was, oh, I don't have my diary. Next meeting. I'm going to get my diary. Okay, so it's starting the enrollment. I mean, the open enrollment soon. Today is the 10th. So yeah, we scheduled it. We said we'll do it in 2 weeks. Is everybody okay with that, or should we make it later? We have it now as scheduled for 2 weeks from now. Is that all right?
I'm not available.
But it'll be recorded. Are you the only one? Okay, so let's keep it the way we originally made it. So the next one would be the 24th. And the one after that would be the 5th. During open enrollment, we thought we had come to some decision. It's probably necessary to learn the new topics that are coming up when people are talking to us. So let's keep it at 2 weeks if we can. And if you don't want to come, you can use the recording. That's it from me. Anybody else have anything? Nope. Okay.
Thank
All
you.
right, well, happy
Thank
open
you.
enrollment, everyone.
Yeah, happy enrollment. Good luck.
Good luck. Good luck.
Good to see you all.
Okay, bye-bye.
Well,
Bye-bye.
welcome back, Krishna.
Bye-bye.